So let's talk about concussion. It's kind of the giant elephant in the room when it comes to sports medicine right now. It was interesting when I started to do sports medicine back in my fellowship. Concussion was kind of on the outskirts of what sports medicine was. Uh, and the NFL and everything that's come along since then has definitely brought concussion to the forefront. It's something that I've actually always been quite interested in. Even when I was at South Carolina and I took care of them, I did a lot with our athletes with regards to concussion, a lot of talks throughout the state in Alabama, down in Florida too, about concussion, the evaluation, the treatment, the management of it. Concussion has changed over the course of the last 6 to 7 years as to how we treat it. The old school way of treating concussion was the classic: you have a concussion, go sit in a dark, quiet room, hibernate for a few days until you felt better, and then join the rest of the world. That's changed. We've realized that that method doesn't work with most kids. So the goal with concussion is always to get a kid back to play when it's safe to get a kid to go back to play. And there are steps. There's how you feel and there's how you function. And part of a concussion is learning how to get you to feel better again and how to get your brain to function better again. So the goal with the return to play is to make sure both feel and function have returned to normal before you're at risk of taking another hit. So I'm very active in the recovery for a concussion. I don't believe in the sit in a dark, quiet room theory anymore. I'm very aggressive with it, but I also don't let kids go back to contact until it's safe to do it. There is an active component to concussion. It's a traumatic brain injury. There is injury that happens to the brain. CAT scans, MRIs, all the neuroimaging tests are going to be normal. But there's still functional disturbance that has to be resolved before you go back to play. So think of it as a computer. What we're doing is making sure the computer has reset itself, has reboot back to where it was prior to the injury. And through medications, through physical therapy, through exertion, there's different things that you can do in order for somebody to recover safely from a concussion to where they can return to their sport and are not at risk for some of the detrimental aspects of concussion.